All right. Well, hello again. This is my case study. So mine was a 32-year-old female who had sudden hearing loss in 2021. She reports having trouble hearing at work, and she noticed her tinnitus is getting worse. She works as a receptionist at an optometry office, and she's noticed a decrease in her hearing, and she also reports having no kids. Like I said before, she has that constant ringing in her right ear, and has become more bothersome, along with oral pressure in the right ear. She denied family history of hearing loss, pain, drainage, and noise exposure. She also denied high blood pressure, heart conditions, all that fun stuff. She also denied dizziness, which I think is super important to note. All right, if you remember my testing here, she had normal hearing in that left ear, and then asymmetry, sensory neural hearing loss in that right ear, with type A TIMPs, good word rec, and SRTs matched my PTA. So I asked you what's next, what were the recommendations you would give, but I'm going to go into the diagnosis. So the diagnosis was actually a acoustic neuroma on her right side. It is located on the distal portion of the 8th nerve, which is probably why there is more of that peak at 2000 hertz. The tumor is smaller than a dime. It is actually, she says, only I think millimeters big. So it's not very big at all. And she is under care of an ear, nose, and throat doctor, and she has been receiving serial testing since everything has started in 2021. So it doesn't look like a typical acoustic neuroma. So I just want to point out not everything is textbook. A lot of the things I've been finding, it's very rare that something is textbook. I think I've only found one textbook case, and I didn't do it because it was too textbook. But I think what really points out here is, what's really pointed out is she has asymmetry with the right ear being worse. Another thing that kind of throws it to the vestibular schwannoma, acoustic neuroma direction is that tinnitus. That's just becoming more bothersome. It's more, her biggest complaint was, again, the tinnitus, not the hearing. It is a sensory neural hearing loss, and I want to point out here that there is that 15 dB air-bone gap at 2000 hertz. It was noted, but also that I wouldn't focus fully on, because that could be due to the retest reliability of bone conduction. Along with that, some ear, nose, and throat doctors take 15 dB air-bone gaps as sensory neural. It just depends on the ENT and where you're located and things like that. So 15 isn't the biggest red flag from some ear, nose, and throat doctors. I think it just depends on where it's at, along with the symptoms that is occurring with it. Due to the fact she has fullness, I think anything would be more concerning about about low frequency air-bone gaps compared to a 2000 hertz air-bone gap. But we will move on. So the recommendations were to continue with serial testing. These were my recommendations. To continue with that serial testing and to monitor the hearing loss, along with that to monitor the tinnitus and see if there's anything else with that tinnitus. I said consider the trial of amplification for the right side and follow up with the ear, nose, and throat just to monitor that tumor to make sure it's not getting any bigger, and just kind of keep an eye on it as time goes on. With amplification, we did actually try a hearing aid on the one side, on the right side. We actually fit her with the Resound 1 hearing aid. The reason we did the Resound 1 is we were able to utilize the tinnitus masker in the hearing aid, along with utilizing the Resound Relief app. I don't know if you guys heard of that or seen it, but it's actually a really cool tinnitus app that you can just download yourself. You don't even have to have hearing aids connected to use the Relief app. She reported that the hearing aid did help with her hearing, but it helped with the tinnitus way more. She truly enjoyed the fact that it helped with the tinnitus and helped kind of blend it in, especially using the Relief app. But she did not want to pursue amplification just yet. think she wanted to try the tinnitus masker herself in a different form, but also due to the fact she was only 32, I don't think she was fully motivated, and I think that vanity issue of being so young and the hearing aid kind of was getting in the way for a second. But she did notice a benefit, and I think she will eventually be back to try a hearing aid again, especially if that tinnitus keeps getting worse like it has been. So everyone had a great hypothesis and recommendations. A lot of people said otosclerosis. Everyone, and I'll talk about that, how I understand how that was a thought. Everyone did say continue with ENT, trial a hearing aid, use tinnitus masker, and people asked if the patient was currently pregnant. So she was not currently pregnant. She has not had any kids, and I don't think she really planned on having any, but that's her decision. I don't know. But she was not pregnant, and the reason it was not otosclerosis is everyone kind of noted that notch at 2K, and I did see some people say Carhart's notch, but if you remember that 2000 hertz bone and airline was a airbone gap, and everything else was sensorineural. With a true Carhart's notch, it's going to be an airbone gap at 5, 1, and 4, with sensorineural at 2000 hertz. So I see where you're going, but it was flipped it's flipped. It's sensorineural at all the other frequencies. The airbone gap was at 2K, which is not a true Carhart's notch. She is the right age for that, but again, it's more flared when you do have that hormonal change with children. But again, she's not pregnant. She doesn't have any kids and wasn't really planning on it. But those were the other guesses that came across, and I think, and the other guess besides otosclerosis was vestibular schwannoma, because the biggest factor here was that tinnitus changing and just asymmetry in that right ear. But I really appreciated reading your guys' comments and what you guys thought. I'm sorry I made it super tricky, but I thought it was something to share and just kind of make the point that not everything is textbook, that sometimes it's a little different. All right. Thank you guys for listening.